So today we're going to be cupping one of our patients who has a particular problem with his short breath and a history of asthma. If you can describe the problem you've experienced over the years, patient X.
If it's humid and I've run a lot, then I get out of breath. I've had asthma as a child. I don't use an inhaler anymore, but occasionally, maybe once every 4 months, I might get out of breath, or dust or particular things cause my asthma, and then I have heavy breathing.
Okay, great. So the point to cup for a patient with this particular problem is the sternum section. We're just going to demonstrate the point here by spraying it with antiseptic spray, just to show you. It's that spot there. Now this is such a significant spot, especially for asthma. If the patient is very sensitive to the antiseptic spray with a history of asthma, then to ameliorate the situation, we can give him a mask. So antiseptic cream around the cup to mark the spot. Onto the spot itself. Now this is the best body throughout the whole human body to cut for asthma related problems. We're going to be using a big and the bic itself is done vertically, not horizontally. All within the confines of the area around, within the cup. So even without the cup, there is blood coming out already. So for the person doing the cupping, it's very important to observe the patient at all times, whether in fact he's conscious, alert. It's possible that the cupping process itself, in very, very rare and extreme circumstances, can cause the patient to actually faint or go unconscious. How does that feel?
It feels like my chest is being compressed, so my skin is being pulled.
Okay. quite a large cut we've got placed at the spot. So there's a lot of blood. Had we used a medium-sized cup, it would have been half full by now. The blood itself is very dark.
More.
It's an enormous quantity of blood. Everything is disposable. So we'll repeat this process for the third time. Just to recap, the first time we do it to mark the spot. The second time we do it after the skin is lacerated with the pick. And the third time we do it just to reinforce the process in case there's some residual toxic blood we haven't picked up. Just to also emphasize that if the area that's being cut has a lot of human hair, it's important to put antiseptic cream around the cut. Now the third time we try the cupping process, we're only expecting a fraction of the blood that came out second time round to extricate itself. So the third time we expect to see much less blood than the second time because the majority of the toxic blood has already been extricated out. But we keep the suction process continuous, otherwise the cut will become loose and slip off.
mostly.
Remember to rub the area gently, because the patient might feel a bit sore because of the cuts and the suction. To try to be as gentle as possible and empathize with the patient. So there's no blood, as you can see. The blood has stopped coming out of this point. And we're going to put antiseptic cream as a penultimate step. The final step, of course, being placing a plaster. So we have a cotton pad. We use the cotton pad because some patients have an allergy to plasters. As well as the glue chemical.